Hathenas, forcing techniques to enhance lung function. We shall now take a look at these important techniques codified by Yoga Maharishi Dr. Swami Gitananda Yoga in the Rishiculture Ashtanga Yoga tradition. The benefits of yoga are many, and the mechanisms are primarily the integration of the breath pattern with coordinated, smooth body movements. This enables a conscious focus on the present moment, stilling the body, calming the mind, and the emotions getting balanced as the breath is steady. Thus, all aspects of human psychophysiological function are improved. Dr. Satbir Khalsa of the USA has given a beautiful schematic of how yoga practices enable the four components of fitness, self-regulation, awareness, and spirituality to blossom in our life, thus enabling an enhancement of the global human functionality. Each and every aspect benefiting each other. The Hathenas are asanas, kriyas, and mudras that enable us to mindfully use all parts of the lungs by consciously forcing air into the bronchopulmonary segments. Based on the concept, yato mana tato prana, where the mind goes, there the energy flows. In the Hathenas, great emphasis is placed on understanding the respiratory system. For the forests are the lungs of the world, and our lungs enable us to connect with the outer nature. The breath is the bridge between the internal and the external worlds. And just as the trees have the trunk, the branches, and those beautiful leaves, we have the trachea and the major bronchi that then further subdivide until finally you end up with the alveolar sacs and those alveoli that serve the purpose of respiration, the exchange of gas at the level of the lungs. The tree within mirrors the tree without. And the lungs are divided into 10 bronchopulmonary segments in each lung, which are individual areas having their own blood supply, nerve supply, and air supply. Each of them functioning on their own and in collaboration with each other in an integrated manner. The use of Vibhaga Pranayama, where we consciously breathe into the low chest region, Madhyam Pranayama, the mid chest, Madhyam, and the upper chest, Adhyam, and then finally bringing them all together in the Mahat Yoga Pranayama, enables us to focus our consciousness into each and every one of the bronchopulmonary segments. A wonderful way for the mind to guide the flow of the prana. In Vibhaga Pranayama, we utilize the front, side, and back of the low lungs in Madhyam Pranayama, the front, side, and back of the mid lungs in Madhyam, the upper lungs in Adhyam, and then we integrate the low, mid, and upper parts of the lungs in the Mahat Yoga Pranayama. To facilitate the consciousness to develop into these areas, the Hathenas, a series of 15 practices, are utilized. These practices enable us to focus in the low, mid, and upper parts of the lungs and then bring them all together in a unified manner. For the low chest region, Madhyam Pranayama, the three first Hathenas are the Ushtrasana 1, 2, and 3, and then the first of the Shashaha, the rabbit postures. These enable us to develop consciousness over the front, side, and back regions of the low lung. developing the consciousness for Madhyam Pranayama. Similarly, for the mid-chest region to develop consciousness for the performance of Madhyam Pranayama, we have the three variations on the fish posture, Matsyasana. Two of them with the legs stretched out, and the third with the legs locked, cross-legged in Sukha or Padmasana. And then the second version of the rabbit, Shashaha Asana, developing consciousness in the mid-chest region. For the upper chest region, we use the two variations of Maha Mudra 1 and 2 that enable us to pump out that air that is stagnant, that is stuck inside our lungs. The stale air can be expelled so that we develop a sense of freshness. The Balasana or Nikunja like a baby, and the third variation of the Shashaha, these develop consciousness in our upper chest region. To bring together all the aspects of the lungs, the low, mid and upper parts, we can do the Hathenas for Mahat Yoga Pranayama. This includes the Vibhaga Pranayama, the tiger breathing, done from the Chatushpada, the four-footed posture, the Chiri Kriya, and then the Shashaha Asana. Thus, enabling us to unify all three sections of the lungs, the low, the mid, and the upper parts. This can be followed by a performance of the Pranava Pranayama using the different mudras, Chin, Chinmaya, Adi, and Brahma or Mahat Yoga Mudra, and the sounds of A, U, followed by the combined A, U, together. Tasya Vajakaha Pranavaha, says Patanjali. Pranava is the vibration of the universe. For the Madhyam Pranayama, using the breathing into the low chest region, we focus on energizing the lower part of the body, and we try to attempt to work on the reptilian complex, that oldest aspect of our brain, of our nervous system, using the breath to breathe into the low chest and then breathe out with the sound Similarly, for the Madhyam Pranayama, focusing on the mid-chest region, energizing consciously the mid part of the body and sending our conscious nerve impulses into the mammalian complex, the limbic system, so that we can start to work consciously with these unconscious and subconscious emotional reactions. We breathe in and breathe out with the sound We can work on the Madhyam Pranayama, the upper chest region, focusing on the upper part of the body, the head and neck, and the neocortex, that part of our brain that enables us to truly become human. Here, we focus on breathing into the upper chest and then breathing out with the sound. Finally, in the Pranava AUM, the Mahat Yoga Pranayama, we are focusing on unifying the low, mid and the upper parts of the lungs, low, mid and upper parts of the body, and the reptilian, mammalian and the human neocortical parts of our brain. Breathing in, low, mid, high, and then breathing out. We have done some recent research at CITER on the Hathenas and COPD. In the chronic obstructive pulmonary disease patients, we found that 4 weeks of using these techniques as an adjunct therapy along with modern medical management, that the yoga group subjects showed enhanced FEV1 and FVC values. That is, the lung capacity as well as the capacity to breathe out in the first second were both enhanced. These are vital parameters for such patients. We also studied the quality of life scores by the St. George Respiratory Questionnaire, and we found that in all the four variations, the symptom score, the activity score, the impact score, as well as the quality of life score, that there were tremendous improvements in those participants who were having the adjunct yoga therapy through the Hathenas. Similarly, we have done some work on the Hathenas and diabetic lung, a condition where the lung function is impaired below 70% in patients who have diabetes mellitus. What we found was that after 4 months of using these practices as an adjunct yoga therapy along with modern medical management, that the yoga group subjects found a decrease in weight and BMI, their fasting blood sugar, postprandial blood sugar, HbA1c, and the kidney function were all improved. And as expected, the lung function in the form of FEV1, the ability to express the air in the first second, and FVC, the total lung capacity, also improved. This shows us that the Hathenas are not just for respiratory conditions, but when you start to breathe properly, when your lungs are functioning properly, when the exchange of gases is happening properly, when the prana is flowing through you properly, all of those parts of you that are not functioning up to the mark, they are reset into a more functional manner. To conclude, the Hathenas are asanas, kriyas and mudras to mindfully utilize all parts of the lungs using the formula of yato mana tato prana. These 15 practices help us focus consciously into the low, mid and upper parts of the lungs and unify all three segments in a conscious Mahat Yoga. This is the type of work being done at our Center for Yoga Therapy, Education and Research in the Sri Balaji Vidyapith, a deemed university in Pondicherry, India. We are supported by a benevolent management and visionary leaders.